Finding the Voices.
Talk show by Monica Iguodam.
I'm a huge fan of Finding the Voice.
You're doing a great job for Manipur.
Manipur bu prithivida masatak pa
good positive voices and make those voices more visible.
We wanted our voice to reach in all the corners of the world.
Interesting people.
Been finding voices on
People from our own place.
Share positive stories and inspiring stories and bring out the good stories of Manipur.
Finding the Voices.
In Manipur, particularly for women's health, I have seen when there has been a mistake or failure during childbirth the mother dies.
Thank you.
There was an incident wherein the public has protested and got the dead body of the mother into the doctor's house. So what is your overall opinion about such incident in Manipur and also the public's outrage and reaction to those incidents?
Ma'am, thank you very much for asking wonderful questions. I really mean it. It's our burning issue in our fraternity. Mm-hmm. I'm telling a very simple example. My father's younger sister was undergoing a gallbladder removal. That was early 70s or so. Mm-hmm. So morning, the gallbladder was removed and she died around 7:30 by this time, 7:38. And we never thought of to go to doctor's home and throwing stone or to take our bodies to doctor's place. Our concern was to complete our our ceremony of burning or so-called. Mm-hmm. But slowly litigation has come up. Mm-hmm. Then even the examination of women, she was some patients started complaining that the doctor was examining aggressively. Mm-hmm. Then in my life, I was doing a cesarean operation at the time Jawaharlal Nehru Hospital. The woman was bleeding, torrential bleeding. Mm-hmm. The blood was gushing out left and right. Baby was delivered, a male baby was delivered, but I could not control the bleeding. Mm-hmm. I have to remove the uterus to save her life. Mm-hmm. I have to remove the uterus to save her life by transfusing 4 or 5 bottles of blood also. She discharged and later on the civil society people come up and you have to give compensation of 1 lakh rupees to her. Mm-hmm. I saved mother, I saved the child also, mm-hmm. but still I have to pay them 1 lakh rupees.
Because she was bleeding?
No, because I have removed her uterus.
Oh, okay. And you had to take that decision because it was, if you didn't remove the uterus, then you could not have stopped the bleeding and it would have costed her life.
Yeah, exactly. And another similar example.
So did you pay? Yeah,
I paid. Because at the gunpoint, mm-hmm. nothing happens. Mm-hmm. Another very just opposite way. I was practicing to Catholic hospital that I had just come back from Italy, and from the Italy they say there's a Catholic hospital and you come to Europe and you enjoy Europe and why did you repay to our Catholic hospital? Mm-hmm. Go sometime. Mm-hmm. I say okay fine, I'll go twice a week at free of charge. I went down there and I was doing some operation and mm-hmm. deliveries and all. One fine day a woman come up and a young girl around mm-hmm. At her 80s and 18 or 20 and she was a relationship with one boy and they go abortion somewhere in the corner and there's some quacks sort of a thing. Mm-hmm. Not a very certified doctor. I don't know actually, but mm-hmm. must be like that. Then her abdomen was distended, the blood loss, the pallor was there. So I was thinking that there must be some perforation in the uterus, because I didn't talk about this clinical thing. So we keep on talking about the, the enjoyable part of the stories. But my thinking was that the uterus may be perforated with the stick, or maybe with the iron rod. So okay, I will open the abdomen and let me see how, if it is a rupture and all, I will stitch it. I will look after it. Then I open it, and when I see it, bleeding is everywhere. The uterus was bleeding. Uterus is just gushing up fit. It was bleeding. And whenever I touch it, the uterus is fragile. It is something like rotten fish, and a little bit of smelly also. Then I have to save her life.
It was infected.
And of course, there was a dread disease also going to come up, because let me complete my story. Then I say I have to remove her uterus. She's unmarried, around less than 20, 17, 18 year old age, lovable young girl. And I have to remove her uterus. And I call her father, look, your daughter is bleeding very severely, I have to remove her uterus. The father was crying in the operation, look doctor, she's my daughter, she's unmarried. How dare you can remove her uterus? I say, you want to, that daughter?
You have to choose her life,
yeah, and or a uterus. And at last, after thinking, I was pressing the uterus and to stop the bleeding. One surgeon also was there with me. Okay, Dr. Saab, anyway, I agree. So I removed the uterus. And it was a very crude operation, because I have to save life very quickly. I have to cut, tie, and stop the bleeding, so that they can, because BP was doing down. Anytime, at any point of time, she died on the table, operation table. So I was suspicious that she is not perforating. She is not, by the abortion was not the problem. There may be some other pathology. I sent very quickly the specimen to the pathologist. At the time, internet was just started, and I'm very grateful, because we met through the internet, and we enjoying ourselves in such a wonderful memory, wonderful stories. And the pathologist, Dr. Davli, says, there again, because I am there again is a Korean carcinoma. It's a cancer.
I see.
It is a Korean carcinoma, very deadly cancer. Because this happened only the Mongoloids, not in the Americans, not in the white Caucasians, not the Africans. We Mongoloid, like China, Burmese, Thailand, Koreans, where we were prone to have this molar pregnancy and Korean carcinoma. I have removed the uterus. Thank God, I saved life. But every doctor's day, the young girl, I don't like to disclose her name, still she says, Dr. Saab, thank you very much, and because of you, I still have the chance to live this wonderful world. For every doctor's day, he passes SMS to me. As the comparison of these two, I saved mother and child.
But you had to pay one lakh in Manipur.
Another, I remove uterus to an unmarried woman, but still for every year, she have got a thank you to me. That's the situation. Coming back to the childbirth, World Health Organization says for every 100 delivery, you should have 10% complication. That means if I deliver 10 women, one have to have a sweat in my face, some problem, bleeding, rupture, tear,
some complication.
I'm not telling.
It's the statistics of the
WHO, World Health Organization. I'm nobody. I'm a small, mere young doctor. Then he says, that's why. But very strangely, a woman delivered in their home. The woman dies. Nothing happened. The woman come to hospital. The woman die. Then a huge cry. And of course, there's a very blanket word of negligence. To my mind, negligence is something like when a woman is crying in a labor table and I was drunk, enjoying myself. That is negligence. But I'm using whatever I was taught my teacher, I'm practicing it. But still, sometimes I cannot save somebody's life in spite of all my effort. And sometimes, error in judgment. Suppose I have to give 3 syringes, 3 injections, but I have given 2. There are also error in judgment. Suppose a preeclampsia, blood pressure was a little bit higher up, 170, 160. We think that it will be all right with the medicine, but it isn't all right. The baby died in the uterus. But baby will never say to me, I am going to die, because we do not know. But if I do the cesarean, take out the baby early, the baby may be immature again. So we are very crucial juncture. So I tell I can say very proudly, any gynecologist, any doctor like me who delivered a baby, if he says, in my life, I never encountered a death in childbirth, or I never have a serious complication in childbirth, either he is telling lies or he never practiced.
So in every doctor's
life,
career, there would be some complication.
exactly.
And
All our colleagues right now practicing in Manipur, 2 or 3 died
during
during childbirth. Almost all. And of course, I don't like to mention few doctors, they never practice. They do family planning operation, finish. They do ultrasound, finish. They never ever touch a childbirth. For them, no issue. So for me, now I completely stop practicing childbirth because it's very risky, and I have to get up in the middle of the night also and call it. So it's a really a challenge to us, but we cannot stop delivering the child. Our younger generation will come up, but my message to our community, to our fellow citizens of Manipur, childbirth is a complicated thing. It may happen to anybody.
So when you're saying you stop delivering childbirth, is that the impact of the...
Oh yes. Not only with me, many of the doctors, of course, it's come in the medical college, it's something different because there's a teamwork. Suppose 4 or 5 doctors are there, one after another, we have to do it, and there also catastrophe happened. Last year we lost 6 women in RIMS and Jenims, one in Chorsanpur also. Nowadays we are very, very cooperative with each other. Any women have problem in Thobal or Chorsanpur or Jenims, we keep on talking. What happened?
So you consult each other and update each other.
Exactly. Because every month we count it, how many women dies.
So in 2015, 6 women in Manipur were recorded dead during childbirth.
Exactly. One from Thobal on the way, one is Chorsanpur at the private hospital, and around 3 or something like that. I couldn't really remember. 1, 2 or Jenims or 3 in RIMS, something like that. And so now we are very much concerned. It doesn't mean that we are neglecting, but when of course government of India is spending crores of rupees to give free transportation, to give free medicine, to improve the quality of the service, and to reduce the death, morbidity and mortality. We call it morbidity means sickness of childbirth. To reduce the sickness during childbirth, to prevent the death of the childbirth. But I promise, I'm sorry to say it, because we cannot have a 0 childbirth death. Even in America, even in Sweden, one of the best healthcare systems in the world. Even in UK also, it is happening. So in fact, we are organizing around 10 years back one sort of a interaction in the RIMS conference hall, and we invited all the women folks. Look, ma'am, in America also women die in childbirth. Then they are a little bit realize.
So my question, I think, is particularly in Manipur, when there is a mob justice, I think the public gets the news about the death of the mother, and then the public also see the mob justice, but we don't get to see why the woman died and what is the complication.
Yeah, actually,
so because I feel that if we get the transparency of the complication, then because what I'm feeling is people are not trusting the doctors in Manipur seeing this, and many are going outside of Manipur for treatment or even childbirth.
Yeah, actually, thank you very much. Honestly, ma'am, thank you very much for this wonderful questions. In RIMS, around 30 to 35, we call it lending, delivery delivered, 35, 40 sometimes. At Jenims, around 25 to 20, 30.
Every day?
Every day.
Okay.
Some come without clothes also, without proper clothing to look after them. But we have to look after it. Once they cross our door, it is our moral obligation to give everything, whatever we have got. Either sometime doctor have to produce some money for her. Even, I'll tell a very, very interesting story. My wife went to Bangalore for his son. I was in the Chinese quarter. One husband and wife come and they didn't have the cloth to fanek to wear it. I have to take out fanek.
They came in the emergency.
Yeah, and I have taken out fanek and to have given because it was a blood soil and all. So they say, okay, we take it. So my wife come up and she was suspicious, right? Why my fanek is gone?
Okay, so they came in emergency. They did not get any change of clothes or anything, so you had provided.
No,
from
many times when somebody complication come up, I spend money. Because I was doing a cesarean, then everything is okay, but the abdomen closing, the closing of the skin below, there was a bleeding. So she developed complication, then I have to reopen it, and it costs around 7,000, 10,000 rupees worth of medicine, and they are asking some compensation also. So I spent around 30,000. Of course, she didn't die, but there was a complication. In surgery, complication is a commonly occurring phenomenon. When you drive a vehicle, sometimes the bulb is fused, sometimes brake is fail. Like that, in the surgery especially, some number of complications come up. So complication is a accepted or universally accepted word, and sometimes it's so increased or near death. So we have called a sort of a subject called near miss. She was almost dying, just bringing back from the god of death. So we call it near miss. Is a subject which we discuss it, how to save a woman. Suppose her kidney has failed, her blood is lost, her everything is gone down, BP is down, how we can bring back to life. So we are very much interested, we are very much day-to-day practice, day-to-day talking each other, how we can improve it, how we can save the life. In spite of all these things, ma'am, one or two have to be. I'm sorry, I'm extremely sorry, I apologize for that, but it is beyond our capacity. It is beyond our capacity. But think of the woman at Parbung, the woman of Kasong Kulen, the woman around 18 hours bus ride. Their childbirth is happening there.
Without any medical assistance.
Yes.
And it's not even counted in the statistics.
Exactly.
Monica, Finding the Voices.
Finding the Voices.
Finding the Voice.
I could see my father. Who came to meet my headmaster because he was unable to pay the fee. I'm sorry.
Because we need such story for people to have faith in the government, in the system, that yes, it's working. And
Let's bring peace in our home state, Manipur.
Who have got the job without bribery, they will do justice to their job, and they will help raise the standard of Manipur.
Me machine creado. I adu paraga tingogi.
We have developed something, we call it high risk pregnancy. We taught our nurses, our young doctors, suppose a woman a very short status, or very long, very tall status, or a woman having a very less amount of blood, and a woman having a already operated, they are called high risk pregnancy. For them we request, we can diagnose earlier. One Tamai, so she was having a heart problem, although she is pregnant. So we request to the community leader, please bring that lady to Imphal, Jerims or Rims. We will pay money. We will give a pair also. But if we can select, we can identify the high risk, probable complicated patients, then we can reduce the death. But we cannot find out the high risk women, perhaps we may lose more women. But coming back to this mob justice, I'm extremely sorry. I feel very uncomfortable because a class 10 pass or class 10 fail guy come up to me and you are not fit to be a surgeon, then where I stand I do not know. Because I struggle all my life. I'm telling the whole story. I expose myself to Europe. I know many things in my life. I can do ultrasound. I do laparoscopic surgery. I do vasectomy. Those kind of patients. There was trend in China, spending lakhs of rupees. And I went to America also. I was in the Queens and the Mount Sinai Hospital. I have seen the world. But a young lady come up and you are not fit for a surgeon, then I don't know where I stand.
So
but
because of that, you didn't want to practice it any longer.
Yes.
So there may be many other doctors who have stopped practicing, which is not really good for the society.
Exactly. This message, kindly through your medium, kindly pass this message. Anyway, I also felt angry when my daughter-in-law died in the childbirth. But it is not the way to bulldoze to the doctor. Let the law court fight it. The court is there or judiciary is there. Because negligence, I repeat again, if the woman is crying in the table, I am drunk and I am enjoying my life, that is called negligence. I am operating it, I am checking BP, I am giving all the medicine in spite of all my effort.
There
if
are complications.
The woman died, then it is not a negligence.
So, so just to, I guess, summarize, do you agree that we do see a lot of news, not only for childbirth, but things like, some cotton or
yes.
things are found. So there are doctors and there are surgeons who have been negligent.
Yeah.
Right.
Thank
so
you.
there are, it's not a blanket statement that there are some doctors who are trying their best, but despite their best effort, complications arise and things go out of control and the patient dies.
Yeah,
but
because
also there are doctors who are negligent. So there is a mix of both.
No, I'm telling you my one experience. Doctors are human beings. Some of them intelligent, some are not that much of intelligence. Some are very careful, some are not that much of careful. Some are really afraid of doing operation, they simply don't do operation. Even our gynecologist folks, some doctors are, they never practice in their home. They never do as much as less as possible. Also there, some doctors are there, they get up at 4 a.m., they do the operation at the private clinic and they come back at around 8:30, examining some patient, home again, rest of the hospital, doing the very good surgery. But keeping some scissor, needles in the abdominal cavity is a common happening.
In Manipur.
In Manipur also, in developed country also. Because it's a tense thing. I tell you, because when somebody is bleeding, because we try to stop the bleeding by any means. But that procedure, we just forgot a small instrument inside the abdominal cavity. But intentionally, the doctor doesn't keep it. It is for you. They don't like that because of the tension. Because surgery is not a.
No, I understand that, but I think when people are complaining, they are complaining or that the ratio or the statistic in Manipur may be higher, and that's why the trust may be less, and they are going outside. So that's what I'm trying to tell.
Because it is a. Yeah, of course you are not in our profession, but I am well taken your word. But around 60 to 70% who went out for treatment outside India, outside Manipur is not a simply waste of money. Because in fact in my one family, because they say, okay, I'm not very happy, but still I have to oblige them. For appendectomy, they goes to Guwahati. Appendectomy is something like I don't know, is something like a cutting a butter and putting to the bread. It's not a simple thing.
But
So
they are going because they don't trust.
No, I think that is, somebody's plate is, look sweeter. Is
Okay,
more,
so
more,
you
more, more
feel that
appealing. Next, my neighbor greenery is more pressure, is more greenery. I think. But we need some brain surgery, heart surgery. We cannot do it. No doubt of it.
Okay.
In Europe, I examine 5 patients a day. It is a good number. But here I examine 50 patients a day in OPD. And you are telling me that we don't believe in our medical in Manipur. You just go to the OPD of Jenims and RIMS tomorrow morning. There are 200 people in queue. Do they come? Believing it? Because their chief is easily affordable. They also believing. That's number one, number two. Because, but again, I was telling that I was doing 100%. That was wrong. I am reminding you again. But again, if I do 2 or 3,
the quality
will be maintained. But what in theaters, in Jenims and RIMS, they only have 12 operations. We want to finish off. Because otherwise the sister will say, the clothes is finished, the water is finished. And the anesthetist say, this is not good, because we are impatient. The quality we are not able to achieve. But that's why we are having more medical colleges, more district hospitals. Now, there was only one hospital, 2 operations. That is in our old district hospital. There was one surgeon, one gynecologist, or maybe 2 gynecologists. Then the led Professor Jatishore, then Madam Chaubi was there. But nowadays, every district has got a gynecologist. Even subdivision has got a gynecologist.
No, this is really good discussion, because I think when we speak about the issue, the public will understand what the doctors and nurses, and when the doctors and nurses speak of their challenges, like you're saying that it is overloaded, or whatever be the then I think the public will understand, and there will be treatment, which of course it's happening, and that's how the whole system will improve. So we do have hope, but this is a very good discussion to identify what particularly in Manipur we are facing.
Yeah, but because I'm a doctor, I have to protect myself and I have my fellow colleagues. But it doesn't mean that when somebody is doing a gross negligence, the woman is bleeding and she doesn't turn up, or he doesn't turn up for half an hour. And I'm telling you something very frankly, and I was operating this thing, and the technicians, he was drunk, and he went away, and the medical superintendent come up with a big lathi, and he was transferred, and this thing. And the medical superintendent was standing nearby and said, "Don't worry, my son, my brother, I'll bring how much of blood we want." We also have this much of supportive system is there. And of course, there's some people who are little bit of negligence.
Yeah, so of course focus on the negligent part, but will not highlight the other success stories. So I would like to hear more success story to share, and share it with the people, and people would look at it and have more faith and trust. I definitely agree with you that there are a lot of patients in RIMS or Jenims right now, but also there are a lot of patients going out of Manipur. And
I agree. But at the end, we are coming, we are developing, we are coming, we are developing. Doctors from Maharashtra is coming here to do their postgraduate. Doctor from Delhi is coming to Manipur to train their MCS, super specialty. Do you think that they are full? They are useless? No. They knows it. Because I'm telling you, I simply cannot touch a patient or without these things. And in Manipur, those students coming from Delhi and Calcutta or Bombay, they have got more exposure, they have got more patients, the more skill. I'm sorry to say, doctor pass off from China, they never get a chance to see a normal deliveries. Because they are done one child, one family, only cesarean they see. So they never get a chance to see a normal deliveries. Where in Manipur, it is done by a simple nurse also. So these are the few areas which we can keep in our brain, in our mind also. So you can't simply say that Manipur is not bad. You can't simply say Manipur is very good. There's some area which is we are far ahead. At some area we are not up to the mark. That I have to open my heart, and this is happening. even in New York, doctor pass out from our medical college practicing, his fee is around 5,000 just for half an hour. It's costing around 5,000. They're also by appointment. And one is in New Zealand, one in the PGI Chandigarh, and 2 in the AIMS also now. So we are producing a quality doctors also.
Yes, of course. I mean, you're talking about the medical college here in Manipur.
Yes.
So
And we are very nice. And coming back, I would like to come back to you. Can I come to your this thing? And I'm really, really admire because you have developed such a wonderful forum of finding the voice, and credit goes to internet, which we meet each other, and I keep on watching your this thing. But how wonderful thing has come up, because I really admire it, because I keep on talking to my friend also. How you start this? Although you are a IT professional, but I don't know. I'm wondering how you started. Give me half a second for it.
Yeah, sure. Again, like for the rest of the world, I think a lot of the media focused on the conflict and news which are only about conflict and death or bomb blasts and things like that. But I know that in Manipur there are a lot of talented people like you.
Thank you.
We need to share the success story and how we struggle, and what are the points wherein we need to develop in a very positive and calm way. So it was my small effort to find the voices in Manipur particularly. That's how I started, and also to inspire the students particularly. My target was the students. So one of the first point when I started, what I thought and I had faced was many students, the parents would think that the only career line is doctor, engineer or IAS. And when they would ask me about other career option, I wouldn't know, because I have a background of engineering. So I thought, why not call the other people who have been born and raised and being successful in other fields and share. So that's how we had expanded, and now it's expanding socially. So the target audience is the global audience who would know people from Manipur who are doing good work. And I think the voices is really going to connect and change all of us in a positive way, but also identify challenges, and will think and work together to bring a change in a positive way.
Yeah, because I wish that your site will be a little bit of expand and interact the rest of the world. And although we are very small chunk of population in India, but we produce a good number of talented person like you, and I wish that we will have one more time and one more interview, perhaps in a better note, not for the diseases and dying and social activities and doctor-patient fighting, bringing dead bodies to the doctor's courtyard, and hopefully we'll meet again in America. Thank you.
Sure. Thank you so
very
much for
Thank
your
you.
support.
Thank you. Thank you.
Please do it at Finding the Voices.